Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Tonight we are talking about leukemia. It's a type of cancer of the blood cells that starts in the bone marrow, which is the soft tissue inside the majority of the bones in your body. Bone marrow is where your blood cells are made, and when you're healthy, your bone marrow will make white and red blood cells and platelets. But for those who are afflicted with leukemia, the bone marrow begins to make abnormal white blood cells, and they grow faster than normal cells, and they keep growing. Here to tell us more is Express Care's Dr. Jitka Lom. Thanks, Doc, for coming in. So how do you get leukemia? I guess it's just like any other cancer?
Well, it kind of is. We call it multifactorial. So there's genetic factors, maybe some hereditary basis, and then some environmental. Basically what ends up happening, though, is that the chromosomes of a certain cell make a mistake. And then what happens is that that cell starts dividing and reproducing abnormally, so that one cell makes a huge number of itself and crowds out the other normal healthy ones in the bone marrow, like you explained.
Okay, and so are there certain risk factors, or some people that are maybe more prone or more likely to get it than others?
Yes, people who've already had chemotherapy for another cancer, people who have Down syndrome, and also people who have been exposed in their environment to certain chemicals, especially benzene.
Okay. Now, we were talking a little bit during the break about the difference that leukemia isn't the same as, let's say, non-Hodgkin's lymphoma. You were talking a little bit about that's more of a solid mass. This is more kind of a fluid in your bloodstream.
In your bloodstream. So it's kind of a difficult concept, like you said. So we have our bone marrow. That's where all the blood cells are made. Almost all of them are made for our immune system, our platelets, and our red blood cells. And so leukemia is a disease generally of the white blood cells that are made in that bone marrow. Then they travel around, and they can also be found in the spleen and in some of our lymph nodes. So you can have lymph nodes that get big because of leukemia. Lymphoma is an actual tumor of the lymph node itself. Okay. So that will swell and get big, or same with the spleen, then it will swell and get big and hard.
Okay. Now, are there different types of leukemia?
There are. So leukemia is divided into acute, meaning sudden onset, very severe, sort of like a big flare of leukemia, or chronic. That's kind of like a slow brewing, long-standing disease. And then it's divided into two kinds of main types of white blood cell. There's myelogenous, that's CML, let's say, or AML, chronic myelogenous leukemia, or lymphocytic leukemia. These are different categories of white blood cells that can be affected, and then they kind of make that clone, huge number of that type of cell that then crowds out the other healthy white and red blood cells.
Okay, so how would somebody, you said sometimes it's acute where it's a sudden onset, and then other times you may have it for a long time but not necessarily know it. So what are some symptoms that people could look for? You mentioned the lymph node.
Right. So let's talk about the acute one first. The acute one, you would definitely know you had it. It affects mostly acute ALL, acute lymphocytic leukemia, affects mostly children. Okay. And that's a terrible disease, but the child will get suddenly very ill, have a high fever, let's say lose weight, have an infection, like a pneumonia or another type of infection. And at that point, they'll have a blood test done, and the doctor say, "Oh my goodness, your white blood cell count is, off the charts. You have leukemia." So that is one presentation. For the chronic kind that you were mentioning, there's one kind, CML, that affects mainly older people, and for that one, they may be completely unaware, and they just have a regular routine blood test done and find out that their numbers are abnormal. And then in any leukemia, once that first blood test is done and the diagnosis is made, the next step is a bone marrow examination. And so what the physician will do is take a sample of the actual marrow from here in the hip with a big long needle, hurts a bit, suck out some of the marrow, and then look at it under the microscope and see which cells are abnormal, and then it can tell you the exact type. And so the acute types, the ones that, especially the one that affects children, that one can be diagnosed pretty quickly and also treated very well, and about 90% of kids will go into remission. So that's really a good cancer to have if you're a child, because it's pretty much going to be cured. The chronic kinds for the elderly, older people, That one often doesn't even need treatment. It's just there, you're aware of it, maybe you should watch out and not get infections and make sure you have a flu shot and all that, but it won't necessarily shorten your life. It's just something that people monitor. And then there's the ones in between, where they're sort of, not that curable, maybe, need radiation and chemo, stuff like that, but the outcome isn't going to be as good.
So radiation and chemo, are those the only ways to treat leukemia?
Pretty much, yeah. Everybody gets chemo for at least the acute kinds. Like I mentioned, the chronic kind sometimes doesn't need anything, but especially for the children or somebody who has an acute leukemia, they will be getting chemotherapy for a really long time. It's many, many months of chemo, and an ongoing treatment for years after that sometimes too.
But it can go away.
It can be put into remission. They never say cure for leukemia. They always say remission.
Okay, sounds good. Well, we will pick up our discussion on leukemia right after the break. Stay with us.